How does schizophrenia develop in children? I think again, in a person, in a family who already are exposed to schizophrenia, that's something which comes to their mind too. To the children, are they exposed to that kind of an environment where schizophrenia, where they are at risk of developing schizophrenia, or what happens? Now, we have to understand children as such, their brains, their ability to understand, assimilate, it's immense. So, one should not think that just because they are being reared in an environment which has probably one of the parent or one of the family members who has that is going to get it. The genetic factors, very much we talked about it earlier, that's one part of it. But in children, again, very, very important to understand that one should not jump into diagnosing schizophrenia so soon. In children, you have to, if there is any concern, if there is any abnormal behavior which has been picked up by the parents, they need to go through a proper assessment rather than just jumping or thinking it is schizophrenia. Yes, they, having done a proper assessment, be it psychological assessment, observations, talking to the child, talking to the family members, if you are in a position to say that yes, it could be a psychotic illness. There can be disorganized behavior, they have difficulty in mingling with other students, probably being able to socialize, play, not being able to pay much attention in classrooms, or having some degree of abnormal behavior, be it being withdrawn and developing some special interests as such, which we don't know. But it is worth understanding that these are all could be a pattern of behavior which needs further explanation before we think of schizophrenia. But if there are definite psychotic symptoms, as we talked about it, delusions, hallucinations, extremely abnormal behavior, disorganized behavior, then that's something which has to be considered. And how it has developed is, again, variety of causes, starting with genetics, starting with the effect of the interaction between the genes as well as environment. But once it is recognized, once it is diagnosed, the course and the treatment part of it is very similar to an adult.